Chairman Lamar Alexander, welcome to Axios. Chairman, thank you.
Thank you, Mike. Good to see you.
We just spent a nice stretch of the nation's time remembering a great man, President George H.W. Bush. What was his biggest contribution to healthcare?
His biggest contribution, of course, I worked with him on education. His biggest contribution to healthcare, I guess, was the Americans with Disabilities Act. That helped millions of American families.
Senator Alexander, yesterday you gave a floor speech where you said up to half of healthcare spending is unnecessary. That's a bold stat. How do you defend that?
Well, I defend it because we've had 5 hearings on reducing healthcare costs, and Dr. Brett James, who's a member of the American Academy of Medicine, said that. He said 30 to 50% of what we spend on healthcare is unnecessary. So I was so startled by that I asked the other witnesses, they agreed with him. And I asked the next panel of witnesses and the next chain, they agreed with him too. That means that of the huge amount we spend on healthcare, that we waste an amount of money, and waste in the precise word, unnecessarily spend an amount of money that's more than the gross domestic product of every country in the world but 9. So my focus over the next 2 years, if I'm chairman of the Health Committee, is to see if we can do 1 or 2 big things to reduce health care costs, and maybe 10 or 12 little things, and try to move the whole debate from health insurance, where we've been stuck for 8 years, arguing about 6% of the health insurance market, that's Obamacare, to health care costs. You'll never get lower cost health insurance until you have lower cost health care.
Now, as part, in conjunction with that floor speech, you sent a letter asking experts to identify ways to cut costs, and you're including in your conversation economists, doctors, nurses, patients, hospital administrators, state regulators. As you did these hearings around the country, what was the best, most practical idea you heard for cutting healthcare costs that could be accomplished?
Well, here's one. Dr. Gross in Florida runs a direct primary care center. You pay him $60 a month, $25 for a child, $10 for a second child, and so for $1,000, $1,200, you get basically all your primary care, which is 80 or 90% of your health care. There are 1,000 such entities in the country, and so you know what you're paying for. That's not insurance. You just pay that, and then if you have to go to a more serious problem, well, then your insurance might kick in. That's an example. The general example I hear, it looks to me like the single most important thing we may be able to do is to find ways to make the healthcare system function with the discipline and the cost-saving benefits of a real market, and to get rid of the barriers that are barriers to innovation that keeps costs from going down. And also to find ways to make it possible for consumers to know the price of the healthcare service they're buying. If we could make the healthcare system a true market, that might do more than anything else to bring down prices.
And you have said that one of the biggest problems is people don't know the true cost.
Well, that's it. I mean, that's the second thing. The first is get rid of the barriers in the way of innovators, but nobody knows. Secretary Azar is going to be here. He's got a great story about how he went for a procedure and found out it cost several $1,000s, and he got on the website and checked around and found out he could get it for $350, $500 in the doctor's office. So the way our system's set up, you don't know the price, and if no one knows the price, prices aren't going to come down.
Now, you talked about over the next 2 years, and in January, we're going to have divided government. We got a little preview, a sneak peek of it yesterday. Our divided government. You were hoping to do 2 or 3 big things. That's a lot, so maybe pick one of them. What is one big thing that you believe you could accomplish next year as chairman?
Well, I'll have to sit down with Senator Murray and figure that out. I mean, whenever we agree on something, we can usually get it done. It just takes a while to agree on it.
What's on the short list? Yeah.
Well, I've already talked with her, and on my short list is reducing health care costs. I've sent these letters, AEI, Brookings, lots of people say, give us something specific to do. I think the thing I'm going to focus on is making the system more of a market, getting rid of barriers, and if I could find a way or ways to make it possible for those of us who buy healthcare services every day to know the price of what we're paying for, that would be the single most important thing I could focus on for 2 years. I mean, we should do that. I mean, members of Congress should not sit around with the facts in front of us that we're spending $1.1 to $1.8 trillion unnecessarily on health care and not do anything about it.
But the question I have about these letters, though, Mr. Chairman, is the people in this room who are very knowledgeable about it will agree the problem in healthcare is not ideas. There's no shortage of ideas.
No, I don't agree with that. Most ideas fail around Washington for a lack of the idea. And I'll give you an example. I went to the National Academy of Sciences in 2005 after a particularly dreary budget meeting and said, I believe if you give us 10 specific ideas in priority order about how to improve American competitiveness, Congress will do it. They formed a commission. Norm Augustine headed it. They did a report called Rising Above the Gathering Storm. They gave us 20 specific proposals in priority order, and Congress did 14 or 15 of them in the American Competes Act. One, for example, is we created an agency in the Department of Energy called ARPA-E after DARPA, which is in the Defense Department. That was a very specific idea. So what I'm hoping is that someone at AEI or Brookings or someone here today will say, I hear you. Okay, if you want to do something to make the healthcare system more of a true market, here are 5 specific things you could do in priority order.
All right. Carl Hulse, in introducing you on his New York Times podcast, said the Republican effort to overturn the Affordable Care Act is in shambles, and the insurance program itself is in serious trouble, leaving Mr. Alexander to try to pick up the pieces. No pressure.
Well, the truth is most health insurance, what he's talking about, of course, is the individual market. Most people have health insurance. 60% of us have it on the job. We don't hear many complaints about that. Most of the rest are Medicare, Medicaid, and 5 or 6%, 7 have individual market. Half of those have subsidies, so you don't hear about that. So we're talking about 3% of the people, the contractor who makes $60,000 a year, is paying $20,000 for his health insurance. We had a plan to fix that. Senator Schumer said that it was good enough for every single Democrat to vote for. And we can pass that anytime the Democrats want to vote for the Hyde Amendment again. So it was reinsurance, cost-sharing subsidies, and giving the states more flexibility without changing the essential health benefits or pre-existing condition. It was very good policy, and the various groups that analyzed it said it might reduce the cost of insurance up to 40% a year. But I don't want to get stuck in the next 2 years on health insurance. I mean, the Democrats have really elevated it to the 67th book of the Bible, and they won't change it even if they disagree with it. So let's move over to health care.
Well,
and let's reduce the cost of health care.
That's clever because health insurance is a loser issue for Republicans.
Well, maybe it was a loser issue for Democrats when they passed it. I mean, we got a Republican Congress based on Obamacare.
All right. Well, probably Senator Kaine may have a different view of that, but my colleagues...
Well, look at 2010 and 2014.
My colleagues, Caitlin Owens and Sam Baker, are colluding over here. They're going to jump in as my phone a friend for a question in just a second. But before I turn to Caitlin and Sam, Senator, you're the rare senator who has both a very strong working relationship with the Senate Republican leader, Mitch McConnell, and the Senate Democratic leader, Mitch McConnell. That's been strained a little bit. How do you think that alchemy, how do you think that ecosystem is going to change as we move into divided government next year?
Not very much in the Senate. I mean, in the Senate, because we respect minority views, I have to get Senator Murray and the Democrats on my committee to approve something, and we're going to get it. We have to work in a bipartisan way anyway. So I think the best opportunity for success sometimes is with divided government. I tell people sometimes, look at Washington as a split-screen television. Between October 6th and November 6th, that was the Kavanaugh hearing started till he was confirmed. There was all this stuff over here. But over here, you had 72 senators, Murray and I, a lot of others, creating a landmark opioids bill. We passed record biomedical research funding for the 4th consecutive year. We passed the biggest change in copyright law that helped songwriters in 15 years. FAA bill, locks and dams and infrastructure bill. We even banned cell phone calls from airplanes. Senator Feinstein and I have been working on that for 5 years, so you didn't have to sit next to somebody revealing their innermost thoughts for 5 hours as you fly to California. All that happened between October 6th and November 6th. So if you look at Washington as a split-screen television this year or the next 2 years, I think you'll see a lot accomplished, but it'll have to be bipartisan.
And Caitlin Owens...
Which is why I'm glad I have a good relationship with Senator Schumer as well as Senator McConnell.
Caitlin Owens has a 30-second question for you as we say goodbye. Caitlin, jump in.
Hi.
There she is.
I want to commend you for your work on the cell phone ban bill. Sounds like a lot of other people do. But just kind of cleaning up a little bit, it's 2 specific areas that you didn't get into where healthcare costs have become a very political issue. It's prescription drug prices, and then now increasingly so, surprise medical bills.
The what bills?
Surprise medical bills.
Oh, yeah.
What, if anything, do you plan to do in these 2 specific areas?
Well, on prescription drugs, Secretary Azar has some proposals that I think are very promising, which I'm sure he'll talk about, and I support them, like making sure in the advertising has the price of what you're buying. Again, if people, we passed a bill just this past year called getting rid of the gag rule, which prohibited pharmacists from telling you that it's cheaper to pay cash than use your insurance to buy medicine. Again and again, it seems to me like making sure people know the price of what they're buying will help bring down the cost of prescription drugs. Surprise medical bills, the same thing. I don't know the solution for surprise medical bills, but we've got to deal with it. Every senator cares about it.
And senators, we say goodbye. One fun thing: who plays a better harmonica, you or Senator McCain? Senator King.
Tim Kaine. He's not, but he has to. He carries around 6 or 7 or 8 because each one is in a different key. And that helps me because then I only have to play in one key on the piano when I play with it. Thank you.
Chairman Alexander, thank you for joining Axios. Thank you very much. Senator Lamar Alexander, appreciate it very much.